start the thing. Before you start anybody on ventilation, this one concept which you all must read and understand is called time constant. Time constant tells you about the characteristics of lung, which is a multiple of compliance into resistance. To make you understand in practical way, it is compliance means how easily lung can inflate or deflate, and resistance means how easily our windpipe can inhale or exhale. In nutshell, it indicates how quickly or how easily our alveoli can fill in and fill out. The implication of this knowledge is very important to initiate the ventilator setting. Like, we come across two kind of settings in initiating mechanical ventilation. One is the condition like obstructive airway disease, and second is the restrictive airway disease. Obstructive airway disease, classically COPD, is a condition of high time constant because the resistance increases in this. So when resistance increases, the time constant is high. So you need lesser inspiratory time and more expiratory time to ventilate the patient, to oxygenate and ventilate. Simultaneously, ARDS is a condition of low time constant because compliance decreases. The lung become non-compliant, and that means you need longer inspiratory time, lesser expiratory time to ventilate the patient. Means a patient of ARDS or like that pneumonia or LVF, you ventilate at the ratio of 1:1 or 1:2. Classically, when there is a severe hypoxemia, it is 1:1, but never in inverse ratio. But when it is a COPD or asthma or obstructive airway disease, then you ventilate in the ratio of 1:3 to 1:8. So if you understand this basic concept, it will be very easy for you to initiate ventilation, keeping the patient pathophysiology or pathology in mind. Now, I just classically present you a case. Nowadays, it's all patients we suspect they will be coming with viral pneumonia, classically COVID. A patient who has fever and cough for 5 days, become breathless, brought to ER. His saturation is 80%, heart rate is 110, blood pressure is 130/80, respiratory rate is 30. He's conscious, able to talk. Now it's like that. What will be your next step? What you would like to do? So you all know that whenever you are going to see patient nowadays in ER, if you are posted in ER, you must wear full protective equipment like protective suit, which is coming because you are the front line and you may get exposed in a suspected case. So it's one thing I want to advise you, that if you are posted in ER, emergency room or ICU, and if you are on duty, always protect yourself. Wear full gloves, gown, mask, hoodings. The way PP has to be protected, there is a separate class on that. But you need to learn, get yourself trained if you have not been trained, and wear that. Now, so my next question to you is, what kind of respiratory support you will give to this patient? Girish, can we vote here? Can we take vote? Girish? Hello?
Yes, Dr. Rahul.
Can you take vote here or shall I go ahead?
Doctor, you can go ahead.
Okay. So if you have to select one best answer, you keep in mind, like you have option of selecting NRBM, high frequency nasal cannula, non-rigid ventilation, and assist control ventilation. So as a customary, whenever somebody comes breathless, hypoxic in ICU, we put them on oxygen. So you have to remember, if patient is breathless, if you are putting on oxygen to buy some time, you have to make him comfortable and at rest his instability to settle down. Suppose you want to select the oxygen,